Thank you. I'm Claire from the COG, and you are our next presenter. And we have about 58 people on the webinar and 8 of us here in the room. And so whenever you're ready to start, that would be great.
Awesome. Great. Let me just share my screen. I can pull up my slide deck. Okay. Are you able to see that full slide, the complete HMO for GIC members?
Yes.
Awesome. Okay. I know you just probably had about 40 minutes of insurance speak. I am going to go over my presentation. Then I also want to leave a lot of room for questions as well. And I know it's the end of the day, so I will try not to be lengthy. But appreciate you taking the time just to learn about the Mass General Brigham Health Plan option. Unlike WellPoint, the Mass General Brigham Health Plan only offers one medical option, and it is an HMO plan. And it is for active employees or early retirees. It is not a Medicare supplement. So it is it's a single option just for anyone who is actively working or early retiree living in Massachusetts. Then this would be an option that you would be able to select. So just a little bit about Mass General Brigham Health Plan. We are part of the Mass General Brigham system, but that does not limit you to just Mass General Brigham providers. That's a common misconception. We do have a full network across Massachusetts. We also have expanded behavioral health coverage through our partnership with Lyra Health. And I'm going to go over some, different value add benefits to help you save money, stay healthy. And then most importantly, best in class customer service. I think that's super important, especially when you're coming on for the first time. You may need some help with transitioning if you choose our plan. And maybe you have a chronic condition or an upcoming procedure or something early in July, and you really want to make sure that you're all set. We do have a specialized team to assist with that. So the complete HMO for GIC members does include our full HMO network, which is across Massachusetts, but it does span into southern New Hampshire and northern Rhode Island. With an HMO plan, you do need to select a primary care physician. And then you do need referrals for certain specialty care. Not all specialty care, but there are certain services that you would need a referral from your primary care. And in most cases, your primary care is typically referring you anyways to see a specialist when needed. Because it is an HMO, you still have coverage, though, out of the country. So if you're traveling, you're on vacation, either across the United States or out of the country, the plan will still cover you for urgent and emergency care. So that's just an important note, even though it's an HMO. Of course, if you're visiting family in California and something happens, you are covered. The plan through Mass General Brigham Health Plan also has tiering similar to one of the WellPoint plans, and it's really only tiering on primary care, specialty care, and then inpatient acute hospital care. So those three types of services will be tiered. Outside of that, you'll see that there's no tiering for providers. So here's just a quick snapshot of the plan cost sharing for the most common services and procedures. Again, this is not the full benefit structure, but just a quick capture of kind of the most common services that people experience. So at the top there, you'll see the deductible. The plan year from July 1st through June 30th is $500 for an individual and not to exceed $1,000 for a family. So if you have 5 people in the family, any combination of those people can get to that $1,000. But each individual on the plan would never exceed 500. You'll see the out-of-pocket maximum. I know that number can look high, can be scary. Just know that the out-of-pocket maximum, what that means is that's the most that you could possibly spend during the plan year on your deductible, your co-payments, etc. So really it's there as a safety net if God forbid you had like a rough year where multiple people in the family had, many services and you were continuing to pay different co-payments and your deductibles. That would be the cap. That would be the most that you could spend out of pocket in the plan year. So it's more of a safety net. The GIC plan is very rich, so it'd be very difficult to get to that 5,000, but it is there as a protection. And then I'll just highlight a couple of the rows specific to the tiering you'll see on the primary care and any of the specialty care services. You'll see the tiering there in the co-payments that apply. So tier 1 being the lowest cost, tier 2, middle, and then tier 3 are going to be your higher cost providers. And then down at the bottom, the very bottom line just outlines what you would pay if you had a scheduled inpatient hospital stay. So Mass General Brigham Health Plan does partner with Optum. It is one of the largest nationwide networks for behavioral health care. But aside from that expansive network, they do also have a Live and Work Well site that has a lot of self-care tools along with a virtual visit platform. So if you're someone that is interested in seeking care and you don't have the time to, make an appointment and go in person, you do have the availability to do a virtual visit as well. And then because we understand that behavioral health care is hard to find and hard to get access, earlier than maybe 6 weeks. And so what we've done is also partner with Lyra Health, which is a virtual first behavioral health platform that you would have access to as a member. It does provide an additional set of providers. There's not really much crossover between the two networks. So it just does give you, more access to different providers. With our platform, they have access to therapy, coaching, medication management. They do have a support team, navigation support to help you get matched with the right care and the right provider for your needs, which I think, helps folks if they're, really looking to find a provider that they can, really click with. It may be helpful to work with that support, and the website does allow you to see bios on each of the providers. I think the cool thing about it is you also have access to their calendar, so you can pick an appointment that works for you, and you're not, calling and then figuring out on your calendar. You can actually sit there and look at their calendar and see what works best. The platform does guarantee a first available visit within 1 to 3 business days. So just, fast, easier access to behavioral health care. So I just wanted to go over quickly. I'm sure you heard a lot of the plans have, different value add benefits. Our plan does offer a fitness reimbursement. So if you have a health club membership or if you're doing, virtual classes, there's a whole list on our website of what would be eligible, but you do get up to $150 for an individual or up to $300 for a family each year. We also do reimburse if you're expecting a child and you want to go through a childbirth education. We reimburse up to $130. And then you may have vision coverage elsewhere. But if you are a member of Mass General Brigham Health Plan, just by showing your ID card, we do have a partnership with iMed, and they would provide you with discounts on lenses, frames, or contact lenses. So just by showing the card at one of those participating iMed providers, they will offer that discount. You would also have access to our new wellness hub. This is at no additional cost. The platform is there to help you if you want to take advantage of it. There's different challenges. There's a health library, information on healthy eating, sleeping, financial health, really helping folks not just about losing weight or exercising. There's a lot more to whole health wellness. There is a health risk appraisal as well. So we always recommend folks do that appraisal because that really helps you understand where you're at, and then just next steps and resources that will be guided to help you achieve your goals. We also have a staff of health coaches, and they will do one-on-one health coaching with our members, either telephonically or via text message, whichever is more convenient for you. But they are staffed. They can help with a lot of different things, including smoking cessation. So definitely, if you're a member, that is a resource that is not really well utilized, but it is a great resource. This is just what you would look at on our website if you are a member and you're going to register for the member portal. This is what the screen looks like. You would create a username and password, and then you would have access to all your health plan information, plan documents, be able to look at your claims, track your deductible, out of pocket, all of those types of things, select or change your primary care physician. So all of that is available to you 24/7 via the member portal. And then in addition to that, we do have a member app. So if you wanted to download that to your smartphone, you would have access to all those same things on your smartphone. Similar to, I think WellPoint talked about having your virtual ID card. So you go to the doctors, you forgot to bring your physical card, you would have access to the digital front and back copy of your ID card, so that you can just show it right there at the office. It's very convenient to have just in case. And then the most important is just how to get in touch with us, how we can help you. There is a barcode here, and I can email these slides after, but the barcode, and then you'll see right above it in blue, mgbhp.org/GIC-members. That is a public page. You do not need to register or log in. It's a public page that you can access all the GIC specific benefits for the Mass General Brigham Health Plan. So the plan documents, searching for a provider similar to WellPoint, it will bring you out to the provider search tool, and you'll be able to see where your providers fall as far as the tier level, and just making sure your providers are in the network. We also, as I mentioned in the beginning, transition of care. We understand that changing health plans can be hard. Change is hard. So we do have a team ready and able to help. If you have, an upcoming, like I said, upcoming procedure, chronic condition, you're concerned about, different things that you might need for July 1st, our team can help you before you're even registered with an ID number. So we can help you prior to July 1st to ensure a smooth transition. And then the customer service number is listed there. We're open 8 to 6 Monday through Friday. We do stay open late Thursday evenings until 8 for additional access. And then we do have, obviously, you can see there the email address. So if you're someone who's busy on the go and don't have time to call during those hours, you can certainly send an email and they will respond to you via email. I will stop talking though and open up the floor for questions.
Thanks, Kristen. We have one question right now asking if the plan is available to Massachusetts residents only.
That is correct. Yep, the GIC they'll only allow Massachusetts residents to select this plan.
Thank you, Kristen. Let's just give questions a few minutes to come in through the Q&A. Anyone who would like to ask a question, you should find a Q&A button on the bottom of your screen.
And if you could send us a copy of the presentation, we also will send that out to folks.
Yeah, absolutely.
You were a late joiner, and so I didn't tell you that we were recording. You may have noticed that on your screen.
I did. Yep, it warned me ahead of time. I'm totally fine with it.
Okay. Okay. I could have trimmed the content, but now I don't have to.
There's another question that just came in asking if there's a +1 or only a family plan.
I think it's the same across the board, individual and family. That's not a health plan specific. That's a GIC rate.
Next question, is Dartmouth Medical Center in Lebanon, New Hampshire covered by this plan?
I believe so, but I don't want to speak out of turn, so I'm just going to pull it up really quick. You said Dartmouth Hitchcock, right?
It says, the question says Dartmouth Medical Center in Lebanon, New Hampshire.
Yes. Yep. In our system. It says Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire. So it is in the network.
Thank you. Yes, and they clarified that they meant Dartmouth Hitchcock.
Okay, great.
I think we're caught up.
We're down to only one other person in the room, so I think there are no questions from the room.
No, I still have 37.
No, I meant live in the room.
Oh, physically in the room. Any questions, Beth? Okay, so this was great. I appreciate your willingness to join us and walk through the details and share your contact information. So perfect. Thanks a lot.
Yes, of course. I'll follow up with the slides in a few moments.
Okay, great. Thanks, Kristen. And to everyone else
Thank
who joined us today, thanks for showing up to learn what you wanted to. Any questions for me from participants? You'd have to put those in the Q&A also. But we can say goodbye to Kristen, and those of us in the room here at the COG will stay on the line for just a few more minutes before we close down the webinar.
Thank you.
Okay, thank you. Tomorrow is
Harvard
Pilgrim and Health New England tomorrow.
right, and that is it's a different link. If anybody wants to join both from out in the webinar, but you have both of those in the chart from your employer. No new questions coming in, so I'm just gonna say goodbye and thanks to everybody.
Wait. Will the recorder webinar be available to folks who could not attend the recording?
So how would we do that? Should we post it on our website? They're going to be huge, so I don't think I want to try to email attach it.
Right.
So but maybe we'd send links to the contacts at all 6 employers.
Is this person coming tomorrow? We can have a definitive answer at tomorrow's session once we talk to our website guy.
So I think what we'll do, because we'll have 4 sets of slides and 2 long recordings, if possible, we'll figure out how to
Post them on the website.
put them on our website, but send to your employer contacts, your HR departments, those links.
So the same way you got the information about today's presentation, you'll get the information on the posted presentations and recordings.
Excellent. Good night, everybody.